Good morning. I am Professor Jisha James, PhD scholar from Malvanchal University from the Department of Medical Surgical Nursing. Here I am presenting my study, a study to assess the perception of flip class method on cervical cancer among nursing students in selected College of Nursing, Kerala. Good morning. I am Jisha James, PhD scholar from Malvanchal University from the Department of Medical Surgical Nursing. Here I am presenting my study, a study to assess the perception of flip class method on cervical cancer among nursing students in selected College of Nursing, Kerala. Abstract of my study, the cervical cancer is a very common kind of cancer in women. It is a disease in which the cancer cells are found in the tissues of cervix. It is usually grows slowly over a period of time. The study shows that among 30 teenagers have good perception, followed 25 teenagers have very good perception and 3 teenagers have excellent perception and significant association found in age and media exposure. Introduction. In today's world, cervical cancer is primarily a disease found in low-income countries. Of nearly 5 lakh new cases that occurs annually, and it is 83% in the developing world. 85% of cases, that is the death associated with cervical cancer, and the South Asian regions harbors 1/4 of the burden of cervical cancer. In India alone, there are estimated 1,32,000 new cases and 74,000 deaths each year. Most of the women with cervical cancer in these countries present with advanced diseases, resulting in low cure rates. This mainly occurs due to the screening, that is lack of screening among general population. Need for the study. According to population-based cancer registries, that's based on 2020, suggested that cancer of cervix has been the most important cancer in women in India over past decades. Bangalore, Bhopal, Chennai, Delhi, Mumbai have shown a statistically significant increase in incidence rates of cervical cancer. The estimated number of new cases during 2009 in India was 96,708. It is 70%. The most important cause of cervical cancer is infection with a high-risk type of human papilloma virus. The types HPV most commonly linked with cervical cancer are HPV 16 and HPV 18. But several other high-risk types contribute to cancer as well. HPV infection is extremely common and generally occurs soon after an individual becomes sexually active. Objective of my study: to assess the level of perception regarding VAK, visual audio kinesthetic, on cervical cancer among teenagers, to find out the association between the level of perception with selected demographic variables. Assumption: the teenagers may have some perception about visual audio kinesthetic and cervical cancer. Operational definition: assessment, estimate of something, estimate size or quantity of, estimate value of taxation. Perception, it refers to the way of understanding and experience of the teenagers regarding visual audio kinesthetic on warning signs, screening and prevention of cervical cancer. VAK method, The visual auditory kinesthetic model asserts that the pupil are visual learners, auditory learners, kinesthetic learners, or a combination of these. Cervical cancer, abnormal proliferation of the cells in the cervix. Teenagers, it refers to children who are between the age group of 14 to 17 studying in selected schools. Methodology. The study approach is descriptive study. The study design is non-experimental descriptive research design. Variables of the study variable and socio-demographic variable. The study variable is the level of perception of VAK method on cervical cancer among teenagers. Socio-demographic variables include age, gender, family income, exposure to mass media, and family history of cancer. Setting of the study, selected schools at Kollam. Target population for this study was teenagers in Kollam. Sample size, the sample size was 30 teenagers. Sampling technique, purposive sampling technique is used in this study. Criteria for sample selection. Inclusion criteria, teenagers who are willing to participate in the study. Exclusion criteria, that teenagers who are not willing to participate in this study. This is the result of my study, the classification of the perception of VAK on cervical cancer among teenagers. 83% is having the very good knowledge, and 6% is having good knowledge, and 10% is having excellent knowledge. Association between level of perception and selected demographic variables. The significant association found in age and media exposure. Conclusion. The study shows all majority of the teenagers have very good perception. 83% is having very good perception about VAK method on cervical cancer. Reference. DC Datta, Textbook of Gynecology. Brunner and Siddharth, Textbook of Medical Surgical Nursing. Wrote in ID, a comparison review of key epidemiological studies in cervical cancer. Beralvi, cancer of cervix, a sexually transmitted infection. Thank you.